I'm Cheung, a medical doctor. This is a short video on palpating for trigger points in the shoulder and neck region. Palpating for common trigger points in the shoulder and neck region. Trigger points are tender, palpable nodules or cords in a muscle or a ligament. When compressed, they're very tender and can give rise to referred pain. There are more than 30 muscles and ligaments attached to the shoulder and neck region. Trigger points in these can cause shoulder pains, neck pains, and headaches, mimicking other conditions. Trigger points are very common in any pain syndromes. They can be the sole or part of the causes of the pain. It is very useful to eradicate them in any pain syndromes. Trigger points in the shoulder and neck region can be caused by, number 1, trauma. For example, a fall on outstretched arms, whiplash injury. Number 2, repetitive strain. For example, slouching over a laptop for too long a period of time. Number 3, constant contraction or activation of a muscle in order to guard and protect a nearby painful structure. For example, constant contraction of several shoulder muscles to protect a minor shoulder pain. The position to palpate for trigger points in the shoulder and neck region. We can palpate a lot of muscles with the patient seated like this. To palpate, I like to use some soluble bath oil or massage oil for better sensitivity. On my palpating hand, I would like to have my 4 fingertips in line for better coverage. Like that. Here is the spine of a scapula. Here is the angle of the scapula. On top, we have the trapezius, the section of the trapezius above the spine of the scapula. We can palpate for trigger points like this, or along its length. Trigger points in the trapezius are very common. They can cause shoulder pain, neck pain, and headaches. And then deep to the trapezius is the supraspinatus. We can palpate for trigger point in this way with the thumb pressing downwards quite firmly along its length, looking for supraspinatus trigger points. And at the same time, we can compare left to right. Now, with our thumbs rolling across the angle of the scapula, we can palpate for trigger points in the levator scapulae muscles. This is very common in neck pains, shoulder pains, and headaches. In this position, we can also feel for trigger points in the clavicular section of the pectoralis major, like so. Trigger points in this is very common in shoulder pain, neck pain, as it balances the tight posterior muscles. Now, standing on one side of a patient with one hand on the front and my palpating hand on the back, this way I can control how much pressure I put on my palpating hand. Now, below the spine of the scapula, we have the infraspinatus, a big triangular muscle filling up most of the scapula to be attached to the humerus. And we can palpate for trigger points like this. Trigger point in the infraspinatus is very common in any shoulder problems. And below that is the teres minor. And below the teres minor is the teres major. And we can palpate for trigger points this way. Now, moving back a bit, Between the spine and the scapula, we have the rhomboid, and we can palpate like that for trigger points, and of course comparing both sides. Now, still standing on the side of a patient, we can support the weight of the head in one hand and palpate with this hand. Under the occipital area, there are 4 little suboccipital muscles and then the paravertebral muscles. Now, trigger points in these are very common in neck pain and headaches. Now, standing more on the front of a patient, we can palpate the sternocleidomastoid, like that. Trigger points in the sternocleidomastoid are very common in any neck pain, shoulder pain, and headaches. There are often many of them, and we just need to very patiently and diligently treat all of them. Now, where the sternocleidomastoid is attached to the mastoid process, here, trigger points here can cause pain in the ear area, often mimicking otitis media. And in this position, we can palpate for trigger points in the anterior part of the trapezius. And then we can palpate for the clavicular section of the pectoralis major and the deltoid, the bicep, and the coracobrachialis. In order to palpate for trigger points in the latissimus dorsi, the patient has to be lying prone. And we need to put some soluble bath oil or massage oil over the area. And we palpate for the trigger point this way, in a rocking motion. Trigger points are usually found along the lateral border of the muscle, and there are usually multiple number of them. Trigger point in the latissimus dorsi can cause shoulder pain, can cause axillary pain, chest pain, breast pain, and often radiating down the inside of the arm, mimicking many conditions. This is a schematic diagram of all the common trigger points in the shoulder and neck region. We should consider including trigger point palpation in our examination protocol. With practice, it can be done in a few minutes. Having found the trigger points in the patient that may have caused the pain, there are many modalities of treatment. Personally, I have found YNSA, Yamamoto New Scalp Acupuncture, to be highly effective. The treatment using YNSA can be viewed in another video.